Hello, and welcome to the San Antonio Jewish Community COVID Vaccination Town Hall webinar. My name is Nami Echolov, and I am the interim CEO of the Jewish Federation of San Antonio, host of this evening's program. We're very grateful to all the local Jewish agencies and synagogues for joining us in supporting and promoting this evening's program. This is a wonderful example of what we can do and how much impact we can have when we join together like this. Thank you again. I'd also like to thank our panelists and moderator this evening. In a moment, I will introduce our moderator, Dr. Amy Benedict, who will introduce our panel of guests for tonight's program. But first, one quick administrative note. If you have any questions during tonight's program, please type them into the Q&A section of the Zoom platform. We have already received many starter questions during the registration process that will guide our initial discussions, and we will get to as many additional questions from this evening as we can. And now for the program. Our moderator this evening is Dr. Amy Benedict. Dr. Benedict is the president of Temple Beth El in San Antonio. She has also held leadership positions for 15 years at the Jewish Federations of North America, both locally and nationally. Dr. Benedict is a practicing pediatric anesthesiologist in Tejas Anesthesia, the director of pediatric anesthesia at Methodist Children's Hospital, and the medical director of the Methodist Ambulatory Surgical Center, North Central. She has recently completed a master's degree in the human dimensions of organizations at the University of Texas at Austin. Dr. Benedict is married to Dr. Richard Benedict. They are the parents of 3 grown children, Ilana, Robert, and Drew. And finally, Dr. Benedict is a model Jewish community lay leader who cares deeply for every member of our San Antonio Jewish community, and I'm honored to call her a friend. Dr. Benedict.
Thank you, Nami, for that lovely introduction. It's a pleasure for me to be moderating this important discussion. Thank you to the entire audience for joining us this evening. This town hall will begin with an introductory statement from each of our panelists. I will then present pre-submitted questions to the panel, of which we have many. I will also make every effort to address questions that are submitted this evening. Let me introduce our panel. Dr. Ruth Berggren is a professor of medicine and infectious disease and the director of the Center for Medical Humanities Ethics at UT Health San Antonio. She is the Marvin Forlin, MD, Distinguished Professor in Medical Ethics, and she holds the James Young Chair for Excellence in Medical Education. Dr. Berggren was appointed by the mayor to be a member of the COVID-19 task force for the city of San Antonio. We are also very fortunate to have Dr. Berggren serving on the Temple Beth El COVID task force. Dr. Tyler Curiel is a professor of medicine in the Hematology and Medical Oncology Department at UT Health San Antonio, and he's the Daisy Skinner President's Chair in Cancer Immunology Research. He's a physician scientist with clinical expertise in experimental therapeutics and gynecologic cancers. His laboratory work is in human immunology. Dr. Curiel's research has been funded by the NIH for over 30 years. Doctors Curiel and Berggren are married and have 2 grown children, and are members of Temple Beth El. Jared Diamond is the owner of National Outdoors and a member of Congregation Agudas Achim. He's a survivor of COVID, having been diagnosed in March 2020. He survived a prolonged hospital stay and continues to recover. He and his wife, Robin, have 3 children. Dr. Berggren, would you open with a few comments, please?
Good evening, and thank you for having us all with you. These are unprecedented times. I will disclose to you all that I have been rounding on the inpatient service at University Hospital. I'm actually assigned to the HIV service right now, but like all of the medicine services, we are receiving COVID patients as well. So just this morning, I was in the hospital and seeing the impact of COVID on our hospital staff and on our hospital resources. And I can't think of a more important time for us to focus in on vaccines and understanding them and how to get them and why they're important.
Thank you, Dr. Berggren. Dr. Curiel, would you share a few comments with us?
Good evening, everybody, and welcome to the program. So you heard that I'm a professor of medical oncology, which is cancer, but I'm also board certified in infectious diseases and have done research in that area for decades. And when the pandemic hit initially in March, I immediately called the infectious disease chair, Dr. Tom Patterson, who incidentally was my supervisor when I was a resident in medicine training. So we go way back. And I volunteered to cover the infectious disease COVID service as needed because I knew they would be in a crunch. And so Tom helped get me certified so I could also serve as an infectious disease doc at University Hospital. And I've been helping them cover the COVID-19 service there. I've done that several times. And I'm also serving on the university's COVID-19 vaccine advisory board.
Thank you very much, Dr. Curiel. That's great. That's a great story. Thanks. Jared, can you share your COVID story with us?
Absolutely. Thank you. My journey started with my wife, Robin, and our youngest child, Abby, went to New Orleans to visit Tulane University. When we went, there was 0 reported cases of COVID at the time. About a week later, when we got home, I developed a sore throat, a fever, and a cough. I went to my primary physician. She suspected that I may have COVID and sent me straight to the hospital. March 16th, I tested positive for COVID-19. My condition worsened and I became so sick that I was placed on a ventilator. Here are some of the facts. I was in the hospital for 26 days with COVID. I was on a ventilator for 9 days. They drained 15 pounds, just to hold up a reference, 15 pounds of fluid out of my lungs while I was intubated. I lost 40 pounds in just under a month. I developed abnormal heartbeat and inflammation of the heart. My medical team told my wife, Robin, I had a 12% chance of survival. When I finally was able to come home, I came home on oxygen and a walker. I still deal with fatigue and other long-term effects, but I'm getting better every day. My wife is my hero. There's no one stronger. Thank you.
Thank you, Jared, for sharing your story. I'd like to start with some questions, and some of the most common questions are, when and where will I be able to get the vaccine, and how will that information be communicated to me? Dr. Berggren, do you want to start with a few slides to give us some information on that?
Yes, so I'm sharing my screen. Could someone confirm that you can see the slides? Thank you. So that was a striking story that Mr. Jared Diamond shared with us. You've been through an extraordinary year, and we're so glad that you're with us, and we're so thankful that you're willing to share your story. But hope is on the way because we have vaccines. And I thought it was quite extraordinary that there are now actually 68 different kinds of vaccine that are in clinical trials for humans. 20 of them have reached the more advanced stages of testing, and at least 90 more preclinical vaccines are under investigation in animals. So you think it's all about just the Pfizer and the Moderna vaccines. There's a lot going on and a lot of research is being done. So we really have so many reasons to be hopeful right now that others will not have to go through the journey that Jared shared with us. I don't want to belabor this slide, but there are 4 big strategies that are being used, and those include the genetic vaccines, which are what the Moderna and Pfizer vaccines are all about, but there are viral vector vaccines. The AstraZeneca Oxford vaccine has already been approved for emergency use authorization in several countries. There are protein-based vaccines, including one that we're doing a clinical trial for here in San Antonio at UT Health. And then there are inactivated or attenuated vaccines. So those are the big 4 vaccine categories. And you may have some questions about those that we can address in a little bit. The mRNA vaccines are the ones that we're getting now. So this is a little cartoon that kind of shows us the mRNA vaccines up close and personal. Disclosure, I got this cartoon from the New York Times Coronavirus Vaccine Tracker. I put the website there and you can explore that later if you want to learn more. It's an outstanding resource. But here's what I want to share with you about this little cartoon. The mRNA vaccines are represented by this little part of our cartoon, and you can see it looks like a slinky that's meant to represent the messenger RNA, and it's in an oily lipid envelope that allows this particle to get inside of a cell. So this is showing you a human cell, and it shows you that the mRNA goes in here and gives a message to this gizmo, which is a ribosome that makes protein. I've likened it to a 3D printer. So a message comes, tells the 3D printer what to make, and what does it make? It makes the spike protein, which then gets assembled from parts, and then it kind of gets broken down into pieces again and gets put out on the surface of this human cell in various different configurations. And it's saying, hey, immune system, wake up. There's a problem here. Come and check this out. But here's a really key point that I think is important for people to understand when they get nervous about vaccine safety. People hear that this is a genetic vaccine and they think it's going to change their genetic material. Notice that at no time does this mRNA have anything to do with the cell nucleus. That's your headquarters. That's where all your DNA is housed. And all the action related to this vaccine doesn't go near the nucleus. It happens outside the nucleus in the cell, what we call the cytoplasm. So that's all the biology I'm going to do about that right now. But just remember, the mRNA doesn't touch your cell nucleus. So many questions from this audience were related to who can get vaccinated, where can they get vaccinated, how can they get vaccinated. So right now, nationwide, we're offering vaccine to people who are in what's called Tier 1A and Tier 1B. And I've listed it there. I won't read every word on this slide to you because I know you can read, but 1As are basically healthcare workers, and they include school nurses and pharmacies, and also long-term care facility residents, so people who are nursing homes. They were prioritized just as highly as people who are doctors and nurses and ambulance care providers. The 1Bs are people who are either over 65 or over 16 with at least one chronic medical condition, which can include pregnancy. And I have a slide about a little bit more specific about what is a medical condition that qualifies you as being Tier 1B. And there's a slight difference between Moderna and Pfizer in terms of who can get it. The Pfizer is approved for anyone 16 and older, and the Moderna, you have to be 18 or older. So that's who can get vaccinated now. And these are the Tier 1B medical conditions. They include all of the things I have listed here with the bullets, but they're not exclusive to those. So there may be other conditions that aren't listed, but you get the general idea. Heart conditions, lung conditions, kidney problems, cancer. Anybody with a body mass index of over 30 is at higher risk for bad outcomes. And so that's why people in these groups are being prioritized. There are 3 major San Antonio vaccination sites, and one of them actually has 2. And they are the Alamo Dome, where we have Metro Health providing vaccination, the Wonderland Mall, where University Health System, our university hospital, is vaccinating. And then there are 2 WellMed locations. I've listed the addresses here. I've also given you websites with the URL addresses. If you go to the Metro Health or the University Health System website listed here, you will be instructed on what to click on in order to try to register. Everybody is full at this moment, but you're going to have to watch the news and watch the websites in order to know when they're going to reopen opportunities for people to sign up. I've included a 24/7 nurse advice line from the WellMed locations. And this is from the WellMed website that they said that as of Wednesday, yesterday, all appointments for their 9,000 public doses that they had available were filled. And they specify that walk-ins cannot be accepted. I think it's important that people understand that. And they assure us that they will work hard to distribute any vaccine they receive as quickly and efficiently as possible. So those are the mass vaccination sites. And people need to know that this is being done all over the country, that and Texas in particular is targeting these large sites as opposed to distributing lots of vaccines to lots of little sites, at least in these early phases. That's how it's being done. UT Health Science Center has vaccinated about 12,000 people, but the vaccine that was allocated was really for our campus, our healthcare providers, and our students who are clinically exposed. We have also begun to vaccinate our Tier 1B patients that are our clinical patients at UT Health. Statewide, I just wanted to put these up there. I won't belabor the point, but you can see the most recent list of where vaccine has been shipped to in alphabetical order by county. And the easiest way to find a vaccine site is to visit that Texas Department of State Health Services vaccine map, and you'll be able to review these websites later on. And this is my last slide, Dr. Benedict. I wanted to let everybody know that you have an opportunity to participate in generating the data we need and helping us with the science, because we have the Novavax vaccine trial underway, enrolling patients for the next couple of months at UT Health. This is one of the protein platforms. So this is a non-mRNA vaccine. It's a more traditional kind of vaccine, similar to, say, the tetanus shot that you would have gotten when you were a kid. And it gives you the spike protein plus a chemical called an adjuvant, which wakes your immune system up. And I've listed the website as well as the telephone number that you can go to if you should like to enroll in this trial. And guess what? It's a 2-to-1 chance of getting vaccine versus placebo. So for every one person who gets just a saline injection, 2 people are going to get the actual vaccine. So your odds are pretty good. And if you're somebody who's not in the 1A or 1B category, it may be a long time before you get vaccine. It could be late spring or early summer, according to our Metro Health Director. And so if you want to get involved sooner, this is one of your opportunities. And with that, I'll stop because I know there are many other questions, but I hope I covered a number of the questions just with these slides. So thank you.
Thank you. And you did, Berggren. I just want to let everyone know, even though it's in the chat, that we will email the resources to you, and they're going to be featured on the Jewish Journal tomorrow. So you'll have access to those. As far as the information that I've received from Dr. Berggren et al., and that in terms of a waiting list, there is no such thing. You need to keep just checking, as Dr. Berggren said, these resources that are given to you and check and see when you can sign up. At this point in time, it seems like everything's full right now, but that doesn't mean things can't change rapidly. Let's see. So that's mainly the location and timing. A lot of questions also were related to second dose. Why do I need to get a second dose? What happens if I don't get a second dose? And is timing of the second dose important? Dr. Berggren or Dr. Curiel, would you like to address those questions?
There we go.
Yeah. So your immune system works by recognizing something that shouldn't be there and then making cells or factors that will get rid of what shouldn't be there. So what a vaccine does is it trains your immune system to recognize things that shouldn't be there. And it's like everything else you learn in life. If somebody tells you something once, you might remember a part of it or about it, but not really so well. So the booster vaccines are reminders to your immune system to remind them, oh, that's what I'm supposed to do something about. I get it. So the booster vaccines can improve the amount of response you make. It can improve the height of the response you can make, and it can improve how long the response lasts. So most vaccines do require boosters, not all of them, but most of them do. So it turns out that with the 2, when we say vaccines, we'll just talk about there's 2 that are approved under the emergency use authorization. The 2 that are out there will afford some protection after a single vaccine boost. And the numbers are still in flux a little bit, but let's say that if you get either of the two vaccines that are available and you get one shot, the amount of protection you get is in about the 50 to 70% range. And that immunity will really kick in about 10 to 12 days after that first vaccine shot. If you get the booster, the vaccine protection goes up to about 95%, which is about as good as it gets. So if you only get one vaccine, you could have some protection. We don't know how long that protection will last because the studies didn't address it all that well. If you get the shot plus the booster, you're going to have about 95% protection, and it should last for at least 3 months. And we're waiting to see if that's going to be longer or not. So right now, the very big recommendation is get the vaccine plus the booster. So the other big part of your question was, what if you miss getting it on exactly the right day? Well, your immune system is not, here's a little secret. Your immune system isn't keeping track all that incredibly well. If you don't come back exactly on day 21 or exactly on day 28, depending on the vaccine you get, the reminder that your immune system gets from the booster is still going to be really good. You still need that booster. Will it be as good as if you got it exactly on the right day? Nobody can tell you with certainty, but as an immunologist, I'd say probably you're going to be fine. Get your boost no matter how late you are. It's going to be helpful. It's not going to hurt you.
Great. And then I also just want to comment that if you received your first dose, you are guaranteed to get a second dose. That correct?
Theoretical. Okay, you just muted us.
Okay,
Dear.
go ahead.
Okay, so that's theoretical, but we hope that everybody that gets the first vaccine will get the boost. It should be that way, but you should not think that it's really a guarantee yet because there's still a lot of hiccups in the supply chain, but that should be the case.
Thank you. Dr. Curiel, can you address allergic reactions? How common are allergic reactions to these two vaccines that we have available? And if I am a person that had anaphylaxis, which is a severe allergic reaction to a food or a medication in the past, should I still get the vaccine?
Dr. Berggren has requested to address that, so I'm going to defer.
Yeah, I just
you, Dr.
reviewed this in an article, getting ready for this evening. So by the end of December, of 2 million doses of the Pfizer vaccine that had been given out, there were 21 cases of anaphylaxis, which is a form of a severe allergic reaction. So that turns into 11.1 cases per million, 11 in a million. So those people were treated on site with the way you normally would treat a severe anaphylactic reaction. They got epinephrine, they got Benadryl, and some of them got more than that. But it's a rare phenomenon, and the people that are most at risk for it are people who have a known pre-existing allergy to either polyethylene glycol or a related molecule called polysorbate. And these are common additives in a variety of medical products, including vaccinations. And so some people with prior history of severe anaphylaxis to a vaccine, where it's thought that they had either polysorbate or polyethylene glycol, those are individuals who should not get this vaccine. If you've ever had a bad allergic reaction to any mRNA vaccine, like in a trial, for instance, or you've had allergy to polysorbate or polyethylene glycol, that's who shouldn't get it. Now, for other people who have had anaphylaxis, such as to bee stings or to food products, it is not contraindicated. You will need to tell the people that are vaccinating you that you have a history of this, and they will then observe you for 30 minutes instead of just 15 minutes, but you can still get vaccinated.
Great. And is there any data on taking something ahead of time, like Benadryl, if you know you're an allergic type of person before you get the vaccine?
So there is no recommendation to do that. We're also recommending that people not take something like ibuprofen or related non-steroidal anti-inflammatory drugs, because we don't want anything to interfere with the immune reaction that's being elicited by the vaccine. However, should you have pain at the injection site or achiness or fever, Tylenol, acetaminophen is perfectly okay. So that would be, I'd just have the acetaminophen ready to go, but I wouldn't pre-medicate.
And I just want to add two very brief things there. That was a really great overview, but just two quick things to add. One is there is no readily available approved test to see if you're allergic or going to have a severe anaphylactic reaction to the vaccine. So don't fall prey to anybody that tells you they have such a test. Don't bother looking for it. It doesn't exist. The other is if you're unsure about your allergic status, or even if you have had very severe reactions, you still can talk to an allergist. And in selected cases, it would still be possible to get the vaccine, but only after consultation with a qualified allergist to understand if you're really at high risk or not.
Great, thank you. In terms of exclusions, other than people who have had anaphylaxis to a previous vaccine, are there specific health conditions where you should not receive the vaccine? It's very commonly asked if it's safe for pregnant women and nursing mothers and immunocompromised patients, such as cancer patients.
Jenna, go ahead.
Okay, so as far as pregnancy goes, there is no indication, meaning that pregnancy hasn't been systematically studied, but it's generally thought to be safe in pregnant women. And in fact, at least one of the two vaccines that are approved under the emergency use are doing trials where they're only vaccinating pregnant women to understand about the safety and efficacy. So I'd say consult with your obstetrician if you're pregnant, and just have a discussion and decide if you think the vaccine is right for you. There's no clear reason not to do it. There is some chatter on the internet that the vaccines can reduce fertility. That really isn't proven. I wouldn't worry about that part of it either. And then the third part, so is pregnancy, other conditions. So if you're immunocompromised, meaning your immune system is weakened, generally speaking, those patients absolutely are at high risk and should get vaccine, understanding that it might not be as effective if their immune system worked better. For almost all autoimmune conditions, there's no evidence at all that there's any problems with vaccines, with one exception. There's a very rare autoimmune disease called systemic sclerosis or scleroderma, and there's a theoretical concern that patients with scleroderma might have adverse reactions to the vaccine. That's not well borne out. And if you have such a condition, you can talk to your rheumatologist or consult with the CDC website. But generally speaking, the vaccine's going to be safe. It possibly won't be as effective as otherwise if you have a normal immune system.
So there's another group of people who should not get vaccinated, and that is people who have active COVID. So if you are sick with COVID, you have a fever, you're in the symptomatic phase of COVID, we ask that you do not come and get vaccinated. Some people have gotten COVID in between their first and second shot. In that case, we actually request that they isolate for the full 10 days plus 24 hours of no fever before showing up for their second vaccine, even if it causes them to be late on their second vaccination. So that's really important that people know it. We don't want folks standing in line with active COVID and infecting everybody else. But other than that, you see the list of people who shouldn't get it or who can't get it is really, 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 really short.
Great, thank you. And going back to the vaccine for a second, we mentioned this briefly, but there's a question in the chat about pre-existing conditions. When you sign up, if you say that you signed up because you have a pre-existing condition, do you need to bring proof of that condition? And when you address that, can you also address asthma? Is that a reactive airway disease? Is that considered a pre-existing condition that qualifies you to get an earlier vaccine?
So in the city of San Antonio, the mayor has made a policy, I think it's a really good one, that they're not requiring anybody that comes in for a vaccine to show proof of a pre-existing condition. They're just going to take their word for it. So what I would just ask is that if you really do not have a pre-existing condition that qualifies, please let those with those conditions that are at risk come in for their vaccines. Otherwise, nobody's going to question you. You're going to be taken at your word. I can't say that's true across the country, but that's true in the San Antonio area, and I think it's a great policy. Regarding asthma, asthma is a lung disease, and that counts as a pre-existing condition that can put you at higher risk, and that qualifies you for 1B.
Thank you.
You do need to bring ID. You don't
Yeah.
need to bring a doctor's note about your conditions, but you need some sort of identification.
Does it, in talking specifically about the vaccines we have, does it matter which vaccine I receive if I'm going to be able to get one, when I'm able to get one? And let's see, we talked about how they work. Can we also talk about these two vaccines specifically, which are mRNA vaccines? Can you just once again touch on the fact that they do not affect genetic material because they don't work in the nucleus of the cell, correct?
Right. So the mRNA it's kind of a molecule that our cells make every day anyway. It's the way your nucleus tells that 3D printer, we call the ribosome that makes proteins, what to do. And so you've got mRNA galore in your body, but you know what direction it's going? It's going out into the cytoplasm. It doesn't come into the nucleus. And there's a lot of mRNA traffic in any given cell. And we have the equivalent of garbage collectors in our cells that go in, kind of like Pac-Man, and get rid of that mRNA once it's given its message. So it goes in, it delivers the message, the protein gets made, and then poof, the mRNA is gone. It doesn't go to the nucleus, it stays out.
Another way to think about it is that in the nucleus, you have your chromosomes, and on the chromosomes are all the genes that give the instructions for you to be you. And genes make mRNA to make proteins. mRNA never goes backwards in humans under normal conditions. There's some infections, but under normal conditions, mRNA cannot go backwards into a gene, into a chromosome. So it's a non-issue.
Great. Thank you so much. Let's see. We also have some previous questions that were submitted that ask about getting COVID from the vaccine. So if we can talk about that, is that a possibility? And what side effects should people expect from the first and second doses of the vaccines?
So no possibility of getting COVID from the vaccine. There's no live COVID there. It's just this little tiny piece of mRNA that only tells your cell how to make the spike protein. And what was the second part of the question?
The second.
Yeah. So Tyler and I have both been vaccinated. So we can tell you firsthand, the first vaccine gave us sore arms. I would say moderate. And I personally experienced fatigue for about 3 days. I wasn't sure whether it was the vaccine or just life, the universe, and everything, but I did feel really tired for 3 days. And then life went back to normal, except that we were very excited that we had been vaccinated. And then 21 days later, we went back for vaccine number 2. And initially it was a big nothing. And about 20 hours later for me, I got very achy, like my whole body just ached. It wasn't the end of the world. I took an acetaminophen. I drank a cup of herbal tea. I went to bed at 8 o'clock. And by the next morning, I was fine. Now, the younger you are, the more significant that second vaccine reaction will be. So for people that are under 55 years of age, we're hearing that they get fever, sweats, and that their aches are pretty significant. And some people need to miss work. But I'm working with some young people in their 20s, some 20 somethings, my residents on the service, and they're all giving me their stories and telling me their experience. What they say is after the reaction is over, it's just completely gone. It doesn't linger. So, it can range from 24 to 48 hours that you're not feeling well, but then once it's done, it's just gone.
Great.
And something else for people to think about if they're thinking of holding out for better vaccines that have fewer side effects. All the information we have on the other clinical trials is the side effects are fairly comparable. And in fact, the new vaccine, the Johnson & Johnson vaccine that might get an emergency use authorization next month, seems to have a lot worse side effects compared to the ones that are out there. So there's no free lunch. These vaccines do have side effects. They're typically very well tolerated, and it certainly beats the alternative of getting the real infection.
I tell you, I actually felt happy when I started to feel the achiness. That sounds weird, but I knew that the achiness means that my body was reacting to the vaccine and that an immune response was being created. So I was willing to tolerate a little achiness for a while for that really great outcome.
I knew there were some advantages to being a little bit older. I knew there was going to be something. The first vaccine, I did have a very sore arm. The second vaccine, I did not have that sore of an arm, but about maybe 15 or 20 hours later, I had some shaking chills for about 30 minutes, and that's really all I had. And I was actually concerned that I wasn't mounting enough of an immune response. I wanted to have more symptoms, but that's really all I had. I never had a fever or any other issues or problems. So it was super easy, and I felt so good and so fortunate. Moving on to the having to get a vaccine again, a booster. How do we know at this time? You had mentioned, one of you mentioned earlier that we know at this time that the immunity lasts for approximately 3 months. Do we know anything more in terms of if we will need to get a yearly booster?
At this point, we really don't. Based on natural history, you can get infected again 3 months after your initial infection. So even natural infection doesn't confer complete immunity like some other infections. And the disease has only been out there for 10 months, and the vaccines have only been out there for a few months. So we just really won't know what happens at 5 or 6 months until 5 or 6 months goes by. And nobody wants to make projections and then later on have to walk them back and say, oh, it's really not going to last as long. So I think people are being really cautious and really careful about that.
That makes sense. Are there any medications that a person can take that will interfere with the vaccine? If they're on specific medications, should they not get vaccine or go off their medications? And can you also comment, besides on medications, on any long-term complications that we know of?
So you want me?
Can I do that?
Yeah. Okay. So if you immune suppressive drugs, steroids, whether they're inhaled, topical, or oral, potentially can reduce your ability to respond to the vaccine. If you're taking those, you should still go ahead and get your vaccine. Other immune suppressive drugs, patients with autoimmune disease, patients with organ transplant recipients typically can be on multi-drug regimens to suppress their immune system. They still should get their vaccine. Patients getting cytotoxic chemotherapy for most kinds of cancers, that will suppress your immune system as well. So in all of those cases, you need to balance taking those medicines for your underlying disease versus getting the vaccine. And you could talk to your doctor or have them refer you to the infectious disease clinic to try to help make decisions in these complicated cases about dose interruptions, dose reductions, or continuing and getting vaccine. But a big bottom line is if you're on immune suppressive drugs, you should still get vaccinated. Don't avoid it because you're on those drugs.
A related topic is other vaccines and will they interfere? And so the rule of thumb is 2 weeks. It should be 2 weeks should have elapsed since some prior vaccine. I had someone consult with me about the shingles vaccine. And so the recommendation is to wait 14 days after a shingles vaccine or something like it before you get the COVID-19 vaccine.
Great, thank you. So after we are fortunate to have been vaccinated, do we still need to wear masks, especially after the second dose of the vaccine? And can I get infected with COVID after I've had my second dose?
Yes and yes. So let's put a little detail in there. So right now, vaccines are not 100% protective. They're just very highly protective, but 95% protection, the other way to think about it is 5% failure. So you can absolutely still get infected after you've had the vaccines, and you shouldn't reduce the public health measures in any way. Right now, we just don't know enough about, even if the vaccine protects you from getting COVID-19, for instance, does it reduce your ability to spread infection to somebody else, even if you yourself don't have disease? We don't think so, but that we don't really know with certainty. The other thing to think about is herd immunity. A lot of people out there still aren't vaccinated, they're not protected. So after your vaccine, count yourself lucky, but keep doing everything everybody's been doing so far for the time being. We hope that'll change. It's not changing in the near future. And do you want to follow up on that?
Just to say that we haven't had reports yet of fully vaccinated people getting sick. There are some people who were partially vaccinated who got COVID in between vaccine number 1 and number 2. Of note, we didn't see severe cases.
Yes, which is great. Can you comment, and you sort of briefly talked about it, can I get COVID, not know it after I've had my second vaccine, and give it to someone else?
Yes, we don't know how common that is, and that's a matter that needs to be studied, and we'll learn more about it over time. But in point of fact, it's possible that the way the vaccine protects us is that it doesn't protect us from getting the virus at all. It's not like you have a shield, a force field that doesn't ever let the virus get into you, but that your immune system keeps it from invading and becoming systemically spread. In the meantime, though, it's possible that the virus could be hanging out in your nose, and that when you sneeze, that you're propagating it. And that's what we're worried about. And that's one of the big reasons why people need to continue masking after they get the vaccine.
Great, thank you so much. How about close contact with other people? So if I'm a grandparent and I want to see my grandkids, they're unvaccinated and I'm vaccinated, how would I do that safely?
Do you want to take it?
No, you go ahead.
So I know that there are lots of grandparents who are just dying to see their grandkids and spend time, and that we all made sacrifices in kind of keeping our families separate through all of the holidays of last year, all the holidays since March. And what I want to say to those grandparents is, once you are fully vaccinated, meaning you're now 7 days beyond vaccine number 2, it is a much better time for you to go and see your loved ones. Now, you got to use some common sense here, because the grandkids, as Amy just said, haven't been vaccinated yet. If you find out that somebody has come down with a fever right before you're supposed to go visit, you're going to have to put a pause on the plan and make sure that nobody there has COVID. And I really do think that, if you're traveling across state lines, going to see a family you haven't seen in a while, there may be some rational reason for the unvaccinated people to have a COVID test 72 hours before you all get together. That's just one more thing you can do to reduce the harm, the potential for harm. But once the grandparents or the loved ones have been vaccinated, that is a time when it is reasonable to start having these small family gatherings. Again, common sense, wash your hands, and don't do it if somebody's not feeling well. And as always, risks are lower when you're doing your family get-togethers outdoors.
Great, that's good to hear. Can you, I know Dr. Curiel, you talked about herd immunity. Can you explain that to our audience, what that means?
So imagine if you walk into a community where absolutely nobody's ever had COVID before, nobody's ever seen the virus before. So everybody's at risk to get COVID-19, everybody. And introducing the virus in that condition, it can spread like wildfire. Now imagine that this person that's got COVID-19 goes into an area where every single person there has immunity, really good immunity to COVID-19. So it's just impossible to give anybody the infection, even if you yourself have it. So herd immunity means that there's enough people out there that are immune that makes it unlikely the virus is going to spread, because it's most likely going to bump up against somebody who's got immunity and stop the virus from spreading. So that part's fairly easy to understand. The hard question is, what constitutes herd immunity? What percentage of people have to be immune, and how immune do they have to be? The short answer is nobody knows. But the longer answer is Dr. Fauci, who is somebody I think is a pretty smart guy and knows what he's talking about, is guesstimating right now that you need at least 85% of the population to be immune from COVID-19 to have herd immunity, meaning if somebody walks into the community that's infected, it's unlikely to spread at all or very far, because most hosts that see it are going to be immune. We're very far from that number. And I would be very stunned if we could get to that number before the end of the summer in the United States. As a country, certain communities might get there sooner or faster, but nobody's anywhere near that right now.
Do you have any guess of when the general public will be, do we have any idea when the general public will be vaccinated?
So per my conversation with Dr. Junda Wu from Metro Health earlier today, it is her opinion that the general population will not be seeing vaccination until late spring or early summer.
Okay, thank you. And then I want to get to some of the questions from this evening that are in the chat, but thank you for mentioning Dr. Fauci, my hero. Okay, so one of them is about convalescent plasma, that if you want to continue donating convalescent plasma, should you not be vaccinated?
No, vaccination might actually help. So if you're convalescent, that your plasma is a valuable commodity. It's not clear how effective it is, but it certainly does have some value. Keep donating. If you get vaccinated, keep donating.
And while we're on the subject, our blood bank desperately needs more supply. So think about donating not just convalescent plasma, but just donating blood, because the blood supply has dwindled due to the COVID pandemic.
Okay, thank you. Yes, that's important. And one other thing is a question about the Pfizer versus the Moderna. If you get one, do you have to get that?
Yes, absolutely. The vaccines are very similar. They're not identical, and we just don't know what happens if you start with one and finish with the other. So there's already too many unknowns. There's already too many things working against us. So if you finish with the one you started with, that's the recommendation, and please don't deviate from that.
Great, thank you so much. This is a very specific question. We're going to end with this, that there is a physician, Dr. Holtz at Baylor, who said that those who get the Moderna or the Pfizer now will need to get a different, more traditional type of vaccine next year. Do you know anything about that information?
I know Peter Hotez. Actually, he's a very smart guy. He's very well informed. I think this is an out of context quote. I'm going to guess that he's allowing for the fact that we are all learning about the efficacy of these vaccines and their side effects. And he's very well aware, as I informed everyone here, there's about 68 different kinds of vaccine that are in clinical trials. And we will have lots of options going forward into the future. What we're seeing is some mutations that are occurring. So far, the mutations don't look like they cause the virus to be resistant to our vaccine-induced antibodies, but there is already another mutation layered on in South Africa where there's concern that convalescent plasma is not neutralizing that virus. So that in point of fact, other vaccine strategies that are being studied now may come into use and may be necessary. That's what I'm guessing Dr. Hotez was probably talking about.
And when he used the word traditional vaccine, And if he meant by that something that's got a protein or an inactive virus in it instead of messenger RNA, my answer to that would be this is the 21st century and messenger RNA vaccines will become the tradition. They're much faster, cheaper, and easier to make compared to what's being called traditional vaccines. And as this virus mutates, because it is, we will need to update our vaccines. And these messenger RNA vaccines are likely to get that done way faster than any protein or virus-based vaccine.
And one other thought is that if somebody has had a severe reaction to the mRNA vaccine, whether it was anaphylaxis or a more mild reaction, the good news is there's going to be this other type of vaccine that will be available for those people.
Great, thank you. And then one last comment in the chat was again about the duration of immunity and how long it lasts. And I think the answer to that again is that we just don't know when you will next need a booster or some other vaccine to protect you. We don't have that information as of yet.
Well, right, so along those lines, here's something to keep in mind. If you've had COVID-19, you do want to get vaccinated again, and you can get vaccinated as soon as your current COVID-19 symptoms get better. There's a recommendation, which I think is reasonable, that it seems like your immunity after the real infection lasts for about 90 days. You could delay getting your vaccine for 90 days, and that will just stretch out the time where you're likely to be immune. That's a reasonable suggestion, as long as you know that 90 days later you can get vaccine, because you might not want to pass up the opportunity if the vaccine's staring you in the face right now. But that's something to consider.
Great, thank you. Let's see. Thanks so much. The information we've gathered tonight has reminded us that the COVID-19 vaccines are safe and effective. In addition, not only will you be protecting yourself by getting the vaccine, you're going to be protecting your family, your friends, and your community. Remember, we all still need to wear masks and practice social distancing. I want to thank our panelists for sharing their expertise, insight, and personal stories during this global pandemic. This community is honored and grateful. I will now turn the town hall over to Nami for some final comments.
Thank you, Amy. Thank you again to our panelists, moderator Amy, and to all the local Jewish agencies and synagogues. And thank you to all of you, our audience, for joining us this evening. Please note the video and resources will be emailed to registered attendees and will be featured on the Jewish Journal website at jewishsa.org. We wish you a safe and healthy future and an easy and seamless path to vaccination. Good evening.